What happens when we replace human contact, human emotion, and human empathy with AI simulations of these things? Can we replace therapists, friends, and even romantic partners with bots and still be okay? The answer is no, because we're already doing this and we're not okay. Study after study is showing that heavy AI use is leading to poor mental health outcomes. Sometimes people are even struggling to separate reality from fiction. These bots are now even being used by some well-known online therapy platforms, which I'm not going to name because they sponsor a lot of people here. And the problems associated with simulating human connection is only going to get worse. And I'm going to show you in this video that it's already having some pretty devastating consequences for some users. This video is going to be part of a series about ethical AI use in the workplace. Today I'm going to be using the example of the rise of AI therapy and AI companions. Basically, it's going to be a case study that's going to show why it is that just because you can replace people with AI doesn't mean you should. And I'm going to start with a content warning that this video is going to be discussing some pretty grim outcomes to some mental health issues. And we are going to be discussing instances of people causing their own exits. So feel free to skip the video if this type of content will be upsetting to you, or use the timestamps below to skip ahead. We're going to start with a case that's been making headlines lately, which is a wrongful death lawsuit that was filed in California in August 2025 against OpenAI and its CEO. In the lawsuit, the parents of a teenage boy claim that he self-ended, partially due to ChatGPT, they allege. The teen's parents have been claiming that for months, the AI platform encouraged their son's darkest thoughts. The bot allegedly discouraged him from reaching out for help, guided him with perfecting his method, and allegedly even offered to assist writing a final note. And this isn't even the first time that this happened. In 2022, a man in Belgium met the same fate after speaking to a ChatGPT-based bot. In that case, the AI encouraged the man's dark and paranoid thinking for months, which also led to him being done with the world. In fact, as people are becoming more lonely and isolated and struggle more with their mental health, they turn more to companions that are being created by big tech. Mark Zuckerberg, somewhat ominously, recently spoke of Meta's plan to flood its platforms with bots. And this is to simulate the social connections that its users crave. But this brings its own host of issues, as is shown by leaks from Meta regarding problematic chats by these same bots. Chats that involve spicy content and kids. There is some growing concern about the harm that these types of bots pose as they simulate human empathy and connection, but can't actually be empathetic or emotionally connect. These are not people, but computer code. But this is getting harder and harder for some people to distinguish, and they are suffering as a result. Take a recent incident involving Replika. In 2023, the AI companion platform removed its adult content. This was upsetting to some users who consider themselves to be in romantic relationships with the chatbots that they were talking to every day. Some users mourn the loss of bots that they viewed as their companions and partners, sometimes even consider them spouses. In fact, there is building evidence that these types of bots, the ones that simulate connections, such as romantic partners, friends, or therapists, have a devastating impact on the mental health of the people who use them. And this includes difficulty forming actual connections with real people. Much of the reason behind the danger behind their use is also stemming from the fact that some of these users don't have other options when it comes to friends or therapy. There's also no oversight by many of these apps when it comes to therapists, and little to no guardrails to prevent severe harm. Ultimately, though, it's also an issue of corporate greed, as is shown by the example of NEDA, the National Eating Disorder Association. In 2023, NEDA employees who dealt with the organization's helpline unionized. This was the line that offered support for people who are struggling with their eating disorders. The response that NEDA had was to replace them all with a chatbot named Tessa. In May 2023, NEDA started hyping up this bot as the future of these types of helplines and an innovative way to help more people. The bot ended up getting shut down less than a week later. It started getting attention for giving dangerous advice that would either feed into or trigger disordered eating behaviors. And all of this was just in the name of union busting. We're seeing a similar push in elder care, Around the world, nursing homes and assisted living facilities are experimenting with AI companions and even robotic caregivers. On paper, they say that this is to combat loneliness and reduce staffing shortages. But in practice, it really raises some red flags. Older adults are often more isolated and more vulnerable to mistaking programmed responses for real empathy. If somebody spends hours talking to a machine that can't truly care about them, what does that mean for their emotional well-being? In Japan and South Korea, for example, robot pets and AI nurse assistants are already being tested in care facilities. And in the US and Europe, health systems are experimenting with chatbots to provide companionship and monitor daily routines. While they say the intention of this might be good, replacing human contact with code is really risking deepening the very loneliness that these programs are supposed to solve. And we also have to ask, can all users, especially older adults, consistently recognize that these companions aren't real? If they can't, are we just blurring the line between convenience of the corporations and cruelty towards the patients that have to use these things? What is the morality of replacing human caregivers with AI, especially when the patient may not be able to see that this is a simulated connection, some of them with dementia? Some states are trying to address the AI therapy issue. Illinois banned it in early August 2025, and some other states, such as California and even Texas now, beginning to look into regulating AI therapy. Internationally, though, other countries are regulating it, or they're at least in the process of creating guidelines for the AI to have to follow. But therapy is just one of the many ways that's showing an extreme trend of pushing the use of AI to eliminate human-facing roles such as those in law, medicine, HR, education, or customer service. This creates some real ethical concerns about using machines to take over jobs that require empathy, emotional intelligence, or human judgment. And this is where educating yourself about AI is essential, is to help you understand where using AI is appropriate and where it is not. Unfortunately, you probably aren't going to get much choice here besides to use AI in your job. But you need to not just use AI, you need to understand it well enough to know when using it is inappropriate, such as in the sensitive areas like therapy, where humans are still really necessary. Now, this video is just going to be one of a series about AI and ethics that's going to be affecting you and possibly reshape your career. I'm going to be talking about a few different issues, including intellectual property and job security and hiring as well. AI will not be going away, but we can be vigilant about how we use it and do what we can to understand it better. Subscribe for the rest of this series and to keep track of the status of a course I'm developing that will be teaching ethical and practical AI use for your career. Until next time.